Okay, welcome to the monthly seminar series for the Western Center for Ag Health and Safety. Before we get started, I want to let you all know that we have interpretation services. So please, in just a moment, select the language you would like to use at the bottom of your screen. Reina?
En un momento vamos a aprender la función de traducción. Si por favor pueden escoger el icono del globo cuando aparezca y escoger el canal que quieran oír esta presentación, o en inglés o en español.
Okay, thank you, Yahaira. And I think that the interpretation feature is turned on, so please go to the bottom globe on your Zoom menu and select either English or Spanish for the duration of the seminar. Okay, next slide, please. Before we get started, I'm going to go over a few housekeeping items. This seminar is being recorded. All participants are muted. So please use the chat function to submit questions for the Q&A session at the end of the presentation. As I mentioned, Spanish interpretation is available, and you can choose English or Spanish from the interpretation language section below. We also have closed captioning available, and so you can select CC icon below and click Show Subtitle. So again, welcome to the March 2022 Western Center for Ag Health and Safety seminar. Today, I'm really happy to present Dr. Keeney, who's going to present to us about occupational stressors and access to COVID-19 resources among commuting and residential farm workers in Imperial County. So Dr. Keeney, I'm happy to turn it over to you.
Thank you. Let me just share my screen. You'll see my family, hopefully, for a second. Okay, can you see my screen okay? All right. Well, thank you for joining me this afternoon. Like Heather shared, my name is Annie Keeney, and I will be chatting today about a recent study that I was a lead on, examining occupational and COVID-19 stressors in farm workers in a US-Mexico region, so Imperial County. Before I get into today's agenda, I would really like to take a minute to acknowledge the Western Center for Agricultural Health and Safety for funding this rapid response study, and for the Imperial Valley Equity and Justice Coalition for their partnership of the recruitment of all of these farm workers in Imperial County. So topics that we will discuss today include COVID-19 disparities, Imperial County, the purpose of the study, methods, findings, our recommendations, and then I'll provide just a little bit of the team members and questions and answers, and then any contact information. So I'd like to set the stage for today's webinar with the quote from Thomas Jefferson back in 1785. Cultivators of the earth are the most valuable citizens. Those words, though these words were said more than 225 years ago, the same holds true today in 2022. So farm workers are the foundation of our agricultural sector in the US, really providing the labor that feeds the nation and beyond. However, both historically and now amid a global pandemic, these non-health essential workers continue to have the worst health and safety outcomes than other occupations in the US. And farm workers are at an increased risk of contracting and dying from COVID-19, even when other social determinants of health are controlled, such as poverty insurance and COVID-19 language accessibility. So the COVID-19 pandemic exacerbated the social inequities that exist between different groups of workers. So essential non-health occupations, specifically workers in industries such as manufacturing, transportation, construction, food and ag, are considered vital for maintaining the health and safety of the nation. However, the occupational risk of COVID-19 exposure, COVID-19 infection, and poor mental health outcomes have been found to be greater among those low wage and precarious workers in these non-health essential occupations. In California, Chen and colleagues found sectors with the highest relative and per capita excess mortality were among transportation, facility workers, and food and ag workers. And across racial and ethnic groups, Hispanic, Latino, working age Californians experienced the highest relative excess mortality and the highest excess mortality among Hispanic, Latino workers in the food agriculture industry. So you can see here on the slide, 97 deaths per 100,000 were California Hispanic Latino workers in food and ag that experienced the highest excess mortality. So Imperial County, I want to give a little bit of background on Imperial County. It's very unique spot. It's right next to San Diego County here on the border of the US and Mexico. And it has the highest proportion of non-white residents in California. However, it ranks the highest among California's 58 counties for the worst social and economic factors, such as injury deaths, income inequality, unemployment, and children living in poverty. It also has the highest food insecurity in the state and the worst food environment index ranking per the USDA in the state as well. The COVID-19 mortality rate in Imperial County alone is more than double the second highest county in California. And early research found that high worker distress and large household sizes contributed to the infection and spread of COVID-19 in the region. And furthermore, the agricultural industry is the dominant sector within the county and within the region. Five times more likely than other counties statewide to work in ag. Or in other words, this is about 1 in 6 jobs are directly related to the agricultural sector in Imperial. Imperial's agricultural sector alone generated an estimated $4.4 billion in the local economy in 2019. It is often referred to as America's winter salad bowl, as it produces more than 100 commodities, including 2/3 of the vegetables eaten during the winter in the US. So to put into scale Imperial agricultural sales, it is about 10 times greater than the entire gross domestic product of the state of Vermont. Or another way of looking at it, at this massive industry, is that it approximately $12 million a day is generated alone from agriculture. And it's very geographically unique, like I shared before. It's located on the US-Mexico border, and farmers and ranchers in Imperial County depend on farm workers that can reside or that do reside on both sides of the border to maintain their operations. The group commuting from Mexicali, Baja California, Mexico, is considered the daytime farm worker population and is typically in the US daily from about 2 to 3 a.m. to 4 to 6 p.m. to ensure that Imperial County's food supply chain continues. Unfortunately, these workers really remain invisible to county public health efforts and are often excluded from vital safety net programs as they're commuting workers from a different country. So the purpose of this study. So Hispanic, Latino, and migrant workers experience high degrees of occupational stress, constitute most of California's agricultural workforce, and were among the most impacted populations by the COVID-19 pandemic. However, relatively little is known about the occupational stress experienced by farm workers who commute daily between the US and Mexico. So occupational stress is considered an imbalance between the demands at work and the capabilities to respond in the context of the workforce. The goal of this study is to determine the type and severity of stressors in daytime and resident farm workers and how COVID-19 vaccination status and resources and access to COVID-19 resources contribute to those stressors. So we collected data over 3 months, June 2021 to August 2021, from Hispanic and Latino farm workers working in Imperial County. Most surveys were administered in Spanish by bicultural and bilingual research assistants who recorded responses in real time through Qualtrics, a web-based platform. We offered a $10 gift card for the participants' time spent answering the survey questions. The Migrant Farm Worker Stress Inventory is a 39-item instrument used to measure stress in migrant farm workers. The respondents rate each item on a 5-point scale, have not experienced to extremely stressful. And then using the same 5-point scale, we also sought responses to 2 additional questions, which were, I worry about the air I breathe at work is not clean, and sometimes I feel like I don't get enough sleep. Data were uploaded in SPSS for analysis, and because one of the study's goals was to describe similarities and differences between the daytime and resident farm worker population, we used univariate analysis to explore the overall characteristics of the sample. Bivariate analysis were used to examine correlations between the stress scores and the demographic variables. And then we also conducted a principal access factor analysis with Verimax rotation on the survey instrument, the total survey instrument, so the 41 items on the survey, to assess the underlying structure. So our sample, a total of 199 Hispanic Latino farm workers working in Imperial County participated in our study. Most respondents indicated that their nighttime residence on work days is in the United States, yet most respondents were foreign-born. The overall age of respondents was 46 years old. Most respondents identified as male, and about 59% or 60% and 40% identified as female. Women farm workers were also more likely to be US nighttime residents, so about 78% of women versus 59% of men. And the average commute time for respondents, so we asked the time from leaving their residence to when they actually got to their work site. For the overall sample was just under 2 hours, so about 116 minutes. Participants whose nighttime residence in Mexico had an average commute time of 194 minutes compared to about 72 minutes of the US nighttime residents. Also, slightly more than a quarter of respondents shared that they had tested positive for COVID-19 within the last year, and then 75% of respondents reported receiving the COVID-19 vaccine, having either the Johnson & Johnson or the complete both doses. So we first ran a principal factor analysis and it differentiated latent factors in our migrant farm worker stress inventory. And it reduced to 5 stressor domains that we were kind of able to put together in categories. So the first factor were health and well-being vulnerabilities. It contained 6 items, really reflecting the interpersonal or physical conditions that US-Mexico border farm workers experience. The second factor, inadequate standards of living / unknown conditions of living, included 9 items reflecting feelings of social vulnerability and how unknown conditions of living resulting from farm work could impede obtaining an adequate standard of living. Working conditions consisted of 5 items about the lack of social, emotional, and physical protection related to the occupation of farm labor. The working environment factor included 4 items reflecting concerns the farm workers have while working on the field site, particularly among other workers. And then finally, the 5th factor, language barriers, consisted of 2 items assessing how communicating in English or not their native language can affect an individual's perceived stressors associated with working. So the total migrant farm worker stress inventory score is obtained by summing the scores for all the items. And possible scores on that 39 item can range from 0 to 156. Higher scores mean a greater degree of stress related to the migrant farm worker lifestyle. Individual scores of 80 or more indicate the individual may have stress levels that pose significant mental health risks. So out of our sample, 40% of our respondents had a score of 80 or more, which indicates stress levels that pose significant clinical mental health concerns. We also found that those farm workers with higher stress scores were more likely to be born in Mexico. So farm workers with high stress scores were more likely to be born in Mexico, about 42% of those above 80 and or more versus 22% of our US born ones, farm workers. So out of the 41 assessed stressors, these were the top 10 stressors between both commuting and residential farm workers in Imperial. Number 1 was sleep. 2 was being away from family members, so the long, working hours. Bad weather, no medical care. 5, working long hours. 6, communicating in English. 7, people using drugs. 8, children's education concerns or stressors. 9, air quality, and 10, bathroom conditions at the work site. So despite similar social and cultural characteristics, the results show that age and country of birth, so being foreign-born variables, can predict greater stress levels associated with the farm worker lifestyle in Imperial County rather than nighttime residents. This finding supports research on the enduring impact of the experiences of citizenship, language, and cultural barriers as foreign-born workers residing in Mexico and the US were more likely to report elevated levels of stress. Of note, I do want to say the top stressors did slightly vary, the number 1 stressor between the groups, with Mexico nighttime residents more likely to experience stress associated with lack of sleep. And then the US nighttime residents express stress from weather and air quality. Now looking at the occupational stressors we assessed in COVID-19. So COVID-19 positive test results and vaccination status were not significantly correlated with nighttime residents. So the lack of statistical difference in COVID infections is really particularly noteworthy since there was much concern in the Imperial County region that daily migrants would be more exposed to COVID-19 due to clustering at the international crossing, waiting for buses together, and then busing together to work sites. There was an assumption in the region that US resident workers would have a lower risk of infection from safer commutes. So these findings suggest that COVID-19 infections may be more likely to happen at the work site, perhaps due to prolonged close contact and lack of PPE or personal protective equipment, both of which have been also found in previous studies. Receiving the COVID-19 vaccine and difficulty in communicating in English were also significantly correlated. The direction of this correlation was positive, meaning that the participants who had received the COVID vaccine tended to report having more stress related to communicating in the English language. We credit the community outreach efforts in Spanish as positively impacting vaccination rates among the region's farm workers because of this. Stressors associated with I have to work long hours and it bothers me people use drugs were significantly correlated with testing positive for COVID-19 as well. So the top 5 stressors experienced by respondents were related to sleep, family, working conditions, and the working environment. I want to differentiate between working environment and working conditions for a second. Conditions are typically associated with how a person physically or mentally feels, whereas environment can mean the immediate physical surroundings of that person. So including nature, people, climate, and these nuances were most pronounced in the unfavorable working conditions and working environment factors that were derived from our principal factor analysis. Of interest was that our findings indicated that others' substance abuse, so alcohol, drug use, stressors, hung together with respondents' concerns of air quality and bathroom conditions. So kind of suggesting that substance abuse was a visible part of the physical work environment. Given our study's context of daily migration and legalized recreational marijuana in the US, or in California, there's an increased concern not only for US-Mexico border farm workers' substance use, but also the secondhand effects of substance abuse that can contribute to an overall unsafe and unhealthy work environment at agricultural field sites. Additional research on the secondhand effect of substance abuse within farming populations is warranted. So, safe and healthy working conditions are essential for decent work. This study increased our understanding of how fundamental worker and human rights are needed to support precarious workers' overall health and safety in the agricultural and Imperial County. Prior to the COVID-19 pandemic, the International Labor Organization said this, asserted that safe and healthy working conditions are essential for decent work. So occupational justice is particularly significant today. Ensuring the health and safety at work, especially among low-wage and non-health essential occupations, is imperative to effective pandemic management, public health prevention efforts within the region, and protecting a highly vulnerable workforce. Mental health, unfortunately, remains a low priority in the region in Imperial County, as indicated by one mental health provider per 660 residents, which is 2.4 times higher than the state average ratio. We encourage farm and ranch employers in the region to take steps to support substance abuse resources and proactively. By doing so, employers in the US-Mexico region may see a reduction of the secondhand effects of substance abuse, thus first creating a safer, healthier, and more productive work environment that has the potential to honestly increase profit significantly. For example, within the agricultural industry, in 2017, it was estimated that the per capita cost to employers for each untreated worker with a substance use disorder is $2,689. Given the scale of the region's agricultural operations and the required workforce needed to maintain those operations, cost savings could be in the billions. Back in 2000, the estimated cost of lost productivity for Texas farm workers due to alcohol and drug use was estimated at $11.2 billion. So our findings have several practice and policy implications. We feel some stressors could be easily improved upon, and it is critical that local farming associations and other groups advocate for efforts to reduce stressors within their control. For example, advocating for improving or increasing bathroom conditions and capacities in the field could improve the health and safety of farm workers. Bathroom conditions, stress associated with bathroom conditions was in the top third of all stressors for the respondents, and is a realistic stressor employers could address that could have immediate positive implications. Like I shared before, we credit community outreach in Spanish as positively impacting the vaccination rates among the region's farm workers. As such, we recommend investing in more Spanish language access to routine public health information and targeted behavioral health campaigns to help essential workers navigate these stressors. For example, resources on substance abuse could make meaningful improvements in the lives of their workforce, or strategies on how to cope with those secondhand effects of substance abuse, or of observing substance abuse. I really like this quote from the World Health Organization, and it shared, to deal with the burden of mental illness and reduce the psychosocial vulnerabilities of individuals, attention needs urgently to be paid to the determinants that can be modified, or the development, onset, progression, and outcome of mental problems. So occupational justice and work-life well-being must be considered as one of these determinants. We must recognize how those cultural differences, subjective judgments, and those theories related to mental health are defined among our Hispanic and Latino farm workers in the region. So we encourage that future studies aim to explore these definitions more. This is a UR code. So essentially, if you grabbed your smartphone and held it up into camera mode and clicked on that, it should pop up, but this is to access the complete study journal article. It's published in an open access journal, the International Journal of Environmental Research and Public Health. So please, if you want to have access to that full paper, use that QR code, and I think staff at the Western Center too are going to share that. But there's definitely more to be said in the paper. This is the research team that just completed this and did all of our work together. We labored over this effort together. So I was the PI, Amy Quant from the Department of Geography. It was the COI, and then Daniela Flores. Oh, and that should say Luis Flores. That is my mistake. I will fix that. They are the co-founders of the Imperial Valley Equity and Justice Coalition in the region, and they were just instrumental in recruiting the participants for the study and making sure it was very relevant to farm workers in the region. Not on our research team was my graduate research assistant, Mercy Villaseñor. So questions I can take. My contact information is here, akeeney@sdsu.edu. So I'll close out the slide, but so I can answer any questions. I'll stop sharing my screen, but then if you need the contact information more, I can put it in the chat. Thank you.
Wonderful. Thank you so much, Annie. It's such a relevant presentation, both for COVID-19, but also what you found and the topics you addressed are issues that farm workers are facing pre-pandemic. They faced it during the pandemic and will afterwards. And I think that's one of the things that's so valuable in the identification of these different stressors, because there are many things that we can and should do beyond the pandemic. One that stood out to me was the language accessibility and the fact that access to or only having information available in English is sort of what I interpreted you to be saying was a cause of a stressor. Do you, was that specific to the workplace, or was that just in the daily life of coming into the United States and living and or working in the United States? I'll stop and I'll do a follow-up after that. Thank you.
Yeah, so if I can understand your question correctly, you were wondering the context of the communication in English, right? As a stressor?
Yeah, which kind of communication was and lack of Spanish language was stressful for these workers?
So it was on the migrant stress farm worker inventory. It just says, you know, stress experienced communicating in English. So in general, it didn't depict at the work site or in personal life. So but it was a major stressor for our respondents there.
Yeah, it just really echoes the things that we hear from our community partners on a very regular basis about the importance to language access, whether it's in Spanish or an indigenous language, and that is really evident in your findings. So thank you for that. A question actually from somebody in the audience relates to the scoring system that you used, and so that stress survey that people might be interested in utilizing themselves. Can you talk a little bit more about that?
Yeah, so it's if you look on my Hovey or Hovey is the author of the migrant stress inventory, and so it is accessible online, and it will provide you with the directions of that. What we did, because with the survey, and we added those two questions. So when we looked at the scores, the cutoff scores of 80 or more, we just looked at it within the 39 questions that the survey had. But for the principal factor analysis, we included all 41 of those items there. So you could probably get some more information on the scoring system within that full paper as well. And I'm also happy to go into the weeds with you if you would like with that.
That's fabulous. And we have that link and we'll share it with all of you shortly for that article. Let's see. So on the COVID-19 front, you talked about, 75% vaccination rate in Imperial County, which is
of
really
the sample
of the sample. Okay, sorry, but which actually might be a little bit lower than the vaccination rate in Imperial County. I mean, folks down there did an amazing job in getting vaccinations out to everyone. How do you think? To what degree do you see that COVID-19 and vaccinations interacting with all of these other stressors? I mean, you clearly identified some linkages, but can you talk more about the COVID-19 connection?
Yeah. So what I didn't cover, we did on this study, because I actually spoke a little faster than I thought I was gonna, but I only had 40 minutes. But the other half of the study was we did some in-depth qualitative interviews with farm workers that resided in Imperial County and farm workers that resided in Mexico. And the big stressors related to COVID-19 was bringing it home to their family. That was a key theme in this. And so there wasn't much hesitation. I think that's why we see the 75% were vaccinated. So I think that part of the protection of their family members was a key driving force to vaccination efforts, and then also coupled with just the ease of the community partners of Imperial County and how they scheduled, did all the appointments and everything in Spanish. So there was, just ease and comfortable with that. Also, what was a defining factor of Imperial Valley Equity and Justice Coalition efforts is that a lot of these residents or a lot of these workers have Mexico numbers. And so a lot of community organizations on the US side can't necessarily call those Mexico numbers, right? And that was not a barrier in this situation because they had the access and the ability to make those calls internationally, which then I think helped drive up, these efforts as well.
That's great. So I to follow on that family element and the transportation issue and the lack of sleep and being, and time away from family as major stressors. Could you, for the audience, describe what a workday might look like for farm workers coming from Mexico into the United States? Because it's not a workday many of us experience.
No, and their hours are very, very hard because of the region's extreme weather. It can be incredibly hot. So you want to get commuting and get to your work site really early in the morning or a little bit later in the day. But if you saw the average commute time was about 2 hours for a Mexico resident. So they are leaving their house right in the middle of the night, and then commuting, going through the international border, getting to the other side, on the US side, waiting for buses to arrive to pick them up, and then going to their work site. So they've already put in several hours, just 2 hours of commute time, not to mention the hours, to take to get ready for your day, right? Your day of work. Before they have even got to their work site to then put in their 8-hour days or however long that they are going to work, and then they do that same commute 2 more hours the next way to get to their house. So one of the comments in the qualitative interviews just shared, I never see my family. I never see my family, and it's because of those long hours and then the commute. And then you can see how that commute is probably one of the factors of impacting their sleep, their ability to sleep or ability to get good sleep, right? And that's a stressor.
Right. Yeah, it's 2 hours one way. So a 4-hour round trip after a really long physical day, adding that on. That is really important. A question from Dr. Pinkerton has to do with, I think, the availability of labor. Were there still jobs in California for the workers coming from Mexico on a daily basis early in the pandemic? Was there, so he's asking about contract arrangements with workers from Mexico to work in the Imperial Valley. Dr. Pinkerton, you might be able to expand upon that a little bit more, but I think that one thing we heard early on was sort of this, are there enough workers? Are there enough jobs? And how does that match up? And so did you see any changes in the labor force from that perspective during the pandemic?
Yeah, so, some early data did share, I think it was in April 2020, that there was a big loss in agricultural jobs, right? About 80%, I think, job loss within that. What was really interesting, and again, that came out of that qualitative data, is a lot of our workers have worked for employers on this side of the border for years, and so some of those workers really helped with COVID testing, right? Even also with vaccine access and stuff. So some of the qualitative data there were like, it was really easy. They brought a mobile thing to our site and I got tested there, and that made me feel better. So I think there was some very established pieces on the employer side that really did help. But there wasn't, I'm trying to see what the other, I don't know if there were other, contract arrangements that were impacted. I know other than probably adding to the additional like commute time or right to get through the border and things like that. Those pieces is what came about with the factor of kind of unsure living conditions, because individuals would come cross the border, it would be okay, but they had no idea what their wait time or if they were going to be able to cross the border going home. And so it added a lot of uncertainty and stress into like, where would they sleep? So what was really interesting that I didn't have time to discuss was we actually had 3 groups. We had US residents, right? A nighttime resident, Mexico nighttime resident. And then we had about 6 people who could not decide which one was their nighttime resident. And they ended up being the most stressed out of when we looked at that stress score. So I think that kind of speaks to not having those stable pieces of where you're going to lay your head down at night can just really impact work stress.
Absolutely. And some of that was COVID specific, do you think, because of the sort of the,
Yes.
okay. So if you were to do this study again in a couple years post-pandemic, you expect some of those numbers might be different because the barrier to the crossing the border was heightened during the pandemic.
Right, exactly. And then, and I can't speak too much to the employer side, but like what I shared, there was a lot of talk in the region that, oh, it's these transit points, these are going to be spreading COVID-19. There was a lot of concern that it was going to be these pieces there that were going to infect or increase numbers more. And that just wasn't the case, right, within this sample.
Okay, great. Thank you. Were there any indicators of why age and country of birth were the predictors of greater stress levels, or do you have any thoughts on that from other literature?
I think there's quite a bit of foreign-born literature out for agricultural health and safety, right, and stressors and mental health outcomes. So, and I think that is just specific to citizenship issues, again, those language barriers, and then just being excluded from vital safety net programs that often these workers experience. So I was not surprised at all with the foreign-born finding to be more indicative of high stress than the nighttime residents. And for age, I don't have any really sophisticated region or response other than I mean, it's right around, again, age where you have kind of small families, or at least you have families of 46 years old average. Most likely you have some children that are not adults yet, and so I think that's where we could see a lot of at least some of those top 10 stressors of worrying about my child's education, being away from my children. Those pieces I think kind of make sense to me when you look at the average age of that sample, and then looking at some of those stressors that were out there.
That's great, thank you. And what about H2A workers? Were they included explicitly in either of your sample or the nighttime residents in the US or in Mexico?
We did not assess or ask that. We had so the workers either were called that were on our farm worker on the Imperial Valley Equity and Justice Coalition's database, right, for getting those vaccine efforts. So we had just specific people that had indicated that they are farm workers, right, and are eligible for those vaccine. And then we had the workers at the transit point. So we would go and go out at like 3 a.m. My research assistant, she's like, I couldn't believe how many people were there at 3 a.m. Yeah. And so that was not a question that we asked. And I it was my impression that region just doesn't see a lot of those workers. Again, because there's such a fluid border, and just kind of those nuances within that area. It's very unique, but I don't know.
That's great. That's wonderful. Thank you. So your paper and this presentation, I think, highlight some potentially really important policy recommendations, or at least implications. And I'm curious, if there's any future plans for you to summarize them for policymakers, or and which ones you might focus on as the highest priorities.
Yeah, so that is kind of what my partners at the Imperial Valley Equity and Justice Coalition and I are discussing, as those pieces, and kind of thinking about, those policy recommendations. We certainly have calls for, we really want to see more resources and funding allocated to those public health announcement services, putting really a lot of emphasis on those transit sites so we can get some information there. And then on the other hand, really trying to encourage local farming organizations to either look at their bathroom policies, or what they have for those conditions. You can't change the weather, right? You can't change the weather in Imperial County. It's going to be hot. But there are some of those conditions that we are more feasible to at least kind of help make the work day or the stress at that site more palatable. But we are generating our thoughts on that. And I know there's been some kind of some attention with some of the funding that was given to those to the county with COVID relief, and that just didn't work, like the housing initiative that did not really take off as people wanted. But I think that kind of speaks to some of the implementation and some of just the other pieces of the county, or that are there within that region.
Yeah, absolutely. I think that there's this pandemic has created a lot of opportunities for us to assess what's working and what's not, and hopefully identify ways of moving forward in an even more positive way.
But I think bathrooms. We are on a bathroom kick for the transit sites, for the work site, the field site. We think that would be it's a human rights issue and worker right, and we do definitely feel that it would significantly help some of those stressors.
And it's an important compliance issue for employers, who are trying to make sure that they are protecting workers as required with Cal OSHA. So that's an important element there as well. Actually, so on that bathroom question, the data that you have related to it is both in the survey and the focus groups. And do you have, what aspects of bathroom sanitation are the concerns there?
We found that both as a high stressor in the quantitative survey, and then the qualitative survey that came, or the qualitative interviews that came out as well. One participant said that she threw up after she tried to use one of the facilities on the field site. It's because it gets so hot, right? And so there's just a lot of pieces that make it very unfavorable. And so I think it does need to be really thoroughly looked at. And again, looking at and getting some feedback from our farm workers, like how can we make this a better experience within that. So it did come out from both pieces of the data, and just probably the amount of workers to the facilities that are there, right, on the field. And then I know that my partners at the Justice and Equity Coalition have been strong advocates of getting some bathrooms on the board at those transit sites, because a lot of the public ones had been shut down because of the COVID regulations, and then there's been slow to come back up, and so it's been a big concern there.
Yeah, absolutely. So there's a question asking for the list again, and maybe that's for the list of stressors. If Sarah, if you could confirm that that's correct. And while you're pulling that up, I sort of had similar questions, and yes, to the list of stressors, if you don't mind pulling that up, Annie. And while you do, maybe one of the final questions really for me is thinking about the substance abuse issue and drug exposure to drug use. And I'm wondering if you have a little bit more context on that, whether from the focus groups and, more qualitative research or from the survey itself.
Absolutely. So hopefully you can see my screen, but yes, so the substance abuse, again, speaking to what is a visible work environment. So we saw this come out in the quantitative survey, and it was over and over repeated in our qualitative methods. So some extreme of, essentially using methamphetamines to have the energy to be able to do the work that is required to do. There, with the idea of legalizing marijuana, that has brought in another aspect that could impact maybe some of the older farm workers' views on being acceptable or not. That would be a place to really kind of further dig into, and those pieces. There was visible drinking, so a lot of tends to be at those transition sites, or you're waiting to get on the bus. So people are like, what are we doing? We're passing the time, those pieces. And then sleep, right? It is a huge impacting factor for some illicit drug use, or to make it a little bit more just palatable with the labor intensive work of back pain, knee pain. You can see that some people are using some substances there to self-medicate because of either some of the stress or the physical stressors that are happening. And it appeared that, it was observed, there's an element of just feeling uncomfortable about it, but also there's an element of like a lot of, some of these workers had worked with this team for a very long time and continue to do that. And so there's kind of some responsibility and some loyalty, right, of like wanting to make sure they're okay, not get in trouble by their employer, but also it's definitely an area I think that needs to be further explored. And on that, and that's why I think the secondhand effects really need to be explored. Like you're observing this, what is that? How is that really impacting your work day and things like that? Because one of the qualitative interviews is like, well, I'm a drinker. I self-disclose that, and it kind of laugh about it. But then what is that looking at on a bigger front of like well-being, like.
Right. Thank you. That's really important work. And I hope that people listening or you, Dr. Keeney, will take that up, because it's not necessarily an individual issue. It's not just a work issue. It's an issue that is crossing many domains of both community and personal life.
Yeah.
With that, go ahead.
Oh no, I've just said the top 10 stressors are up there on the board.
Absolutely. Thank you so much. And for those interested, we'll make sure that you have access to the paper that Dr. Keeney mentioned that this presentation was derived from, and we'll be publishing an article about that as well in our upcoming newsletter. I want to thank everyone for coming, and thank you, Dr. Keeney, for sharing so many great insights about the experience of farm workers, a really unique set of farm workers in California and Mexico. Our next seminar will be held on that's today. Okay, on April 4th at 4 p.m. And we're gonna learn about identifying workers who are at risk for valley fever in California from graduate student Savannah Hunter. So I hope you'll join us for that. And thank you, everyone. Have a wonderful afternoon.
Thank you.
Thank you. Bye.